gastritis is the irritation and inflammation of the stomach's inner lining. Often, it makes one feel acutely aware of what is happening in their stomach, as if the stomach has become sensitive. Gastritis develops when the stomach's protective layer, known as the mucous membrane, is compromised and damaged, usually by infections, stress, or medications. Various bacteria and viruses can cause temporary gastritis, but chronic gastritis is often caused by the bacterium Helicobacter pylori. While almost everyone with gastritis experiences symptoms, in 10 to 15% of cases, it develops without any noticeable signs. The first symptom is abdominal pain. The most common presentation of gastritis is abdominal pain and discomfort, often described as burning, gnawing, or aching. This pain, more stable and constant, resembles burning sensations or hunger pangs. It occurs in the upper middle area of the abdomen, known as epigastric pain. The second sign of gastritis is increased pain on an empty stomach, which is often relieved by eating. However, spicy, acidic, and fatty foods can exacerbate the pain, which can last from several minutes to hours. The third most common sign is nausea and vomiting, occurring in about 60% of people with gastritis. It is typically described as a persistent urge to vomit, especially pronounced before or just after eating. Certain foods, smells, and even stress can exacerbate nausea. The fourth sign is indigestion and heartburn, present in about 50% of cases. Patients often feel a burning sensation starting from the stomach and rising up to the throat, particularly after eating fatty, spicy, or acidic foods. Many report temporary relief after taking antacids, and smaller meals and stress management also help with heartburn. The fifth sign is bloating and a feeling of fullness. Some people experience fullness and bloating even after eating small amounts of food, accompanied by belching and discomfort. This can lead to early satiety, a loss of interest in food, and consequently, weight loss. The gold standard for diagnosis is endoscopy and a visual examination of gastric mucus and inflammation, along with a breath test to identify Helicobacter pylori. Either of these tests is sufficient for diagnosis. Diseases that can mimic gastritis include peptic ulcers, esophagitis, and gastric cancer. Treatment typically includes a combination of antibiotics, such as clarithromycin and amoxicillin, for 7 to 14 days, and proton pump inhibitors like omeprazole and lansoprazole. Antacids are used in cases of gastroesophageal reflux symptoms.